Hello, all of you. Thank you so much for joining us today. My name is Shelley Junkin. I'm part of the leadership team here at MyPracticeConnect. I get to work closely with our clinics and our partners, our pharmacies to just keep the platform running smoothly and then basically look for lots of new opportunities for everyone. We also have our, what I call our dream team. Casey, Emma, and Sarah are all on here, and they are what basically drives the success of MPC, working with each of you. And we're excited to just be a part of this webinar today. Um, Everyone attending today's webinar will be emailed our free, well, it's not free, but to you, it will be a free GLP-1 titration guide. And then one lucky person at the end of today will be drawn to receive 47 social media posts. It fits Facebook and Instagram on all of the peptides. So it's all ready for your branding. You just kind of slip it into Canva, add your logo, and then you're good to go. So stay tuned for that. We do have special pricing for webinar attendees as well. So if you're interested in grabbing that for yourself, we do have great pricing. We'll share that at the end as well. And with that, I'm basically excited to hand things over to Dr. Agin. He's going to walk us through the latest advancements in peptide therapy and all of the things, regulations and Wolverine stack, lots of different things today. So you'll be excited to be with him as he explores that. So Dr. Agin, the floor is all yours.
All right, so it's okay to just get started and let people join.
Yeah, we'll
Perfect.
have the recording as well for anybody who misses the front end.
Okay, great. So perfect. So just a preface, when we talk about advances in peptides and then navigating the 2025 landscape, that's pretty much is the advances in peptides is to understand navigating the landscape of regulatory issues that we're facing with peptides. There are some new and exciting peptides, but all of that is going to fall under the landscape of what we can and can't use, or at least what the regulations say, which is what we're going to make a little bit of at least advance the understanding of where we're at. And also just to understand is that, when we get into this whole thing, I'm going to share a little bit of a history for people that are listening that have been in functional medicine for many years. They're going to understand this, but also for the people that are just getting into functional medicine, this is important for you to understand the history, both to understand what the FDA is doing and also to understand what the FDA has done so that it can make sense of how we can get through this whole thing and still be able to provide good medicine. Because, in the grand scheme of medicine, we all know that there are good and bad in everything. And in this business, there are people that have abused the system multiple times in many different ways. And the FDA's job is to make sure that medicine is being practiced safely. And in the world of compounding pharmacies, in the wellness medicine, there are a lot of ways that people can get hurt, and people can cut corners. And by chasing the dollar, you can get into a situation where the government has to step in, and we've seen this multiple times. There's abuse of pain creams, genetic testing, HCG went out of control. The opiate disaster and other things have caused the government to have to step in. Now, do they always do things right? No. I mean, I think that they can do things differently, but there have been many times in history that something had to be done, because unfortunately abuse of the system. And so, we have to look at working with the FDA and trying to work around it, but more importantly is showing you how they operate so that you can understand why we're having this conversation, because it's not just clear cut. You can't do anything. It's not them necessarily trying to prevent us from practicing. It's just a different modality. Remember, traditional medicine is all about treating disease, and we are all about getting healthier, improving vitality, and getting to root cause and disease prevention. This is something that a lot of these peptides don't do. They're not a direct treater of disease, and so they can get misinterpreted, and then obviously we're left trying to deal with what the FDA wants to do with it. So just know that this is something that's gone on, and we're just going to have to try to deal with it best we can. So I definitely don't want to scare everyone, but I want to provide an overview and then kind of show you how myself and other people that have been doing this a long time what we're going to do to navigate our prescribing habits and how we're going to make this or use this in functional medicine. Sorry. So a little bit about me, just so you guys understand where I come from. I'm a physician. I'm in Clearwater, Florida, practicing. I did my undergrad in medical school at Michigan State University and my residency at University of South Florida. I've been practicing functional medicine my whole career. I have never practiced one day in a traditional medicine setting. I got right out of residency and jumped into concierge and functional medicine. I also owned a compounding pharmacy for 6 years. So this is something that I know near and dear to myself. And so just understanding that this is something that I've been part of my whole career, and so hopefully I can shed some light onto what I have seen from every side of medicine, pharmacies, and actually using a lot of these therapies myself. So jumping in, our objectives quickly, we're going to give a little history and update on the current regulations, what we can still prescribe on the current 2025 regulations, talk about some new and emerging peptides, discuss research use only peptides because these are a very hot topic, talk a little bit about the peptide stacks, go over some GLP-1 updates, and then talk about our prescribing considerations in functional medicine foundation, understanding the rules that we have and how we can move forward. So to start, let's get into the regulations. So as I told you, I started practicing functional medicine in 2022. That's when I finished my residency. And so you can see that the timelines follow a very similar regulatory pattern. So you can kind of see what happens. What normally goes on is that there's a product, a drug, a therapy, a supplement, something's out there that develops and turns into a hype. And with social media today, this hype can be transmitted very, very fast, very, very aggressively. So the hype now is as easy as it's ever been. And so when the hype is there, it usually leads to mass use. And what happens is there's a massive production, more than the FDA can even manage as this just mass production, whether it's compounding pharmaceuticals or supplementation or manufacturers, these products get mass produced. And then we're left in a situation where the FDA steps in, starts looking at this and saying, okay, what's going on here? Why is everyone using these? And should they be using them? They start making comments. All the people manufacturing them, using them, involved in the supplement or drug at any point, will start sending in reasons why they feel that it should still be legal and be able to be prescribed or utilized. Those are rejected, and then the enforcement starts. This five-step process has been going on for years, ever since I got into medicine. And so just a little bit of regulatory timeline you can see in 2002 to 2004, it's kind of started, and that was with ephedra. Ephedra was in Metabolife, it was in Hydroxycut, it was in so many different weight loss drugs, and very effective. People were using it anywhere from 50 to 100 milligrams per dose, sometimes up to 200 milligrams. I used ephedra, usually at much lower doses, but it was a great supplement. It was Mahwang, really the first time that the government took a supplement off the market or an herb, and made it illegal. And you guys might recall wondering why all of the various cold remedies started getting put behind the counters and locked up. And that's because when ephedra got removed, it was also the number one supplement that was being used in creating meth. And so when crystal meth was not having access to ephedra anymore, they started using pseudoephedrine, which was in all the cold remedies. And then you can see why that got started. And so, but ephedra was one of those ones that I believe really got removed for the use in meth more than the use in wellness. I think ephedra was a very clean supplement when used right, but again, just an indication of what can happen. After that was HCG. People remember the HCG diet. Compounding pharmacies were making HCG as fast as you possibly can. I was one of them. During that time, I had a compounding pharmacy, and we were making HCG. We were compounding it, lyophilizing it, utilizing it in both hormone therapy and not as much in weight loss in my use, but when it was used for weight loss, that turns into false claims. People were claiming that you could use HCG to lose weight. The government steps in. Wait a minute. Why are there people claiming that you can lose weight with HCG? They could find no association with HCG and weight loss. They jump in and say, okay, well, you can't use HCG for weight loss anymore. They tried to reject it, showed all the different ways we could use it in hormone therapy. Didn't matter. The enforcement went in and it was removed. So then we get to the NECC, which is the New England Center for Compounding. This is what turned the turning point for everything. In 2012, this is when a small manufacturer of bulk use drugs, methylprednisolone, they had a horrible clean room, horrible business model. They sold thousands of vials of methylprednisolone that went out, and they were so many cases of spinal meningitis, fungal meningitis from this. 64 people died, over 700 were hospitalized, probably one of the biggest crises or disasters in healthcare history. That was the turning point. So from that point on, everything changed. I owned a pharmacy up until that point, 2012, had to sell my pharmacy's clean room because the regulations that came in after that were too much for a lot of the small pharmacies to even survive. And now you can see that basically from that point on, they went into the hormones. People were making hormone combos with testosterone, estrogen, and HCG in them. That went down. Then they went to SARMs, which is the selective androgen receptor modulators. Those were again trying to jump into the HRT or TRT without regulations. And then you got into stem cells and exosomes, and then here we are today with peptides. So you can see goes on, and we've had a history of it. So that's also a way that we can look and say, here we are today having this discussion, and we're still practicing functional medicine, so we can survive. When you look at step three or point three here, this is specific for peptides. So you see the 2012 turning point with the New England Center for Compounding. Then they have the Drug Quality Security Act, and then the bulk drug list, and then they split into 503 and 503B, and then you end up today with this final ruling where we're at today. I could have spent a lot of time just going over all of the changes that went from 2004 till now, especially in regards to compounding pharmacies, and then going from 2012 to now about what happened specifically with peptides. But that's the bottom line. They just keep making changes. We tried so hard to get them to see that we could have clinical results. We tried with thymosin alpha, thymosin beta, BPC, but the government rejected it and just did not find there was a clinical need. And when we're talking about clinical need, when you see with 503Bs, it's important for providers to understand clinical need does not mean that we find that there is a clinical need for the drug. This means that the pharmacies are trying to say, is there a clinical need for the powder, for the actual ingredient? That's the clinical need. And if they don't think there's a clinical need for that ingredient, it's not even going to become a drug. It doesn't matter if we feel that that peptide had a clinical need for our clients. So just understand that's different than the clinical use statement that we're putting on some of our prescriptions. This is a pharmacy or a drug ingredient clinical need. And then, of course, we get to the 2025 final rule. So that brings us to today, and this is where we're at. What's still prescribable with that January 2025 statement? And so when you look at the green zone peptides, you can see that the list is pretty ridiculously small. Now, I guess it could be nice that there's anything on here, PT141 or bremelanotide. It's on here because there is a drug that is in use right now for sexual arousal disorder, or ED, that's being used. And so when it's on the short list, or it becomes potentially compoundable. Oxytocin, Sermorelin was one of the first growth hormone releasing hormone secretagogues. I still, prescribe Sermorelin. It's still a great drug. It's still available. You can see semaglutide in the non-salt, so that means it's not the ones that have the acetate or the semaglutide sodium on the end of it, which is often the ones in compounding pharmacies. And then, of course, tirzepatide. The yellow zone, this changes from, various lists, but pretty consistent on the yellow zone, which is still a little bit of ambiguous and investigational. These are still said to not be compounded and not be utilized or prescribed. But you have AOD 9604, which was an obesity drug or obesity peptide, melanotan 2, which is used for managing UV exposure, creates tanning, suppresses appetite, and actually can have some soft tissue work as well. Thymogen, immune modulator, KPV, GHK copper, kisspeptin. So there's some of these select GHRHs or growth hormone secretagogues, but basically this is another short list. So we get into the red zone, explicitly not allowed per the FDA, that these are the ones that, which is in other peptides that are not on this list, but this is the vast majority of the ones that are exciting and we are getting used to. GHRP2 and 6, that was removed early in my career, or were at least the first two growth hormone peptides to be removed, and they've been kind of dancing in the background. But you can see that this was a pretty major blow to the peptide industry by this statement. And so but don't worry, we're gonna talk about what this means. And again, remember, this isn't the first time that stuff like this has happened. So understanding what the regulations are, we can still talk about some new emerging peptides because they're exciting. And we have to be optimistic that some things are going to change. There are some people that believe with the new political regime that they are talking about actively making changes to traditional or non-traditional medicine, allowing a pathway for homeopathy and natural repairs and natural therapies. So there is a chance that some of these peptides will be available and be able to be utilized. And so we'll talk a little bit about them. So the PDA or peptide direct adaptations or adaptogens or peptides like MOTS-c, humanin, and SS31. I've used MOTS-c and SS31, and I have not used humanin, but these are mitochondrial peptides. Very exciting because these are ones that target what I believe is the cause of all disease, which is mitochondrial dysfunction. So all of these PDA peptides are very exciting because anything that can improve or mitochondrial biogenesis or improve mitochondrial function is going to be a very good opportunity for us when we look at how much disease that we're faced with. So these are exciting. We just again we'll talk about what this means for prescribing. Cognitive repair peptides, FGL and dihexa. FGL is a neurotrophic peptide that works with improving both of these drugs actually help improve or increase brain-derived neurotropic factor, improve neurosignaling, reduce neuroinflammation. Again, with the rise of dementia and dementia becoming kind of very possibly the next pandemic, these peptides would be very important for future opportunities. Longevity peptides, epitalon. If no one knows about this one, this is one that does have human studies. It works on longevity, directly on longevity by working on telomerase or decreasing the shortening of the ends of our DNA and the telomeres, or actually in some cases being found to actually lengthen the telomeres. So very, very exciting. Immune peptides, vasoactive intestinal peptide and thymogen. These are immune modulators. Thymogen is basically kind of a combination of thymosin alpha and thymosin beta. Again, great opportunities, exciting that they're in the pipeline, and exciting to see how we will be able to utilize these. So when we get into the research use peptides, this is a very important one because not only do I get questions about research peptides by a lot of colleagues, I get questions about these by patients almost every day. Patients, friends, family, everybody's trying to understand these because there is an onslaught of social media conversations about these peptides. So it is worth us going over this and so people can understand it. So RUO means research use only or not for human consumption. These are not drugs. They are chemical ingredients. That's the bottom line. It doesn't matter if it's in a vial. It doesn't matter what it looks like. For providers with medical licenses and medical practices, this is the way we have to approach this. They're not for human consumption. So when you have a medical license, that is what the FDA and the governing bodies, whether it's the Florida boards, the boards of pharmacies, your licensure, the state licensure, they're all going to say the same thing. It doesn't matter what we want to think or if we know people in the manufacturing of research use peptides, it doesn't matter. This is what they're saying. So they're sold legally only for lab research, analytical testing, and cell and animal studies. The sites are not supposed to mention human consumption at all, but we know that they do. So the FDA allows research use only peptide sales if the seller does not claim human use. So from our perspective, we could buy them technically, but you can't inject them. You can't offer them to your patients. You can't relabel them. You can't put stickers on them. You can't get them in pre-filled vials or syringes. and you absolutely can't discuss them. You can't even let someone bring them into your office and they buy them on their own and bring them into your office and inject them or help them inject them because you do not know where they got them. That is, again, remember, you can know the best manufacturing facility, and know the people that are running them. They can tell you all the testing they're doing, and you can believe them and actually want to use them. But again, as a medical providers, we just can't. So why is this happening? We just talked about the social media. This is a low barrier to entry. Anybody could be a manufacturer or reseller of peptides. They're like supplements. High consumer demand, the biohackers, the influencers, the TikTokers. I have seen people literally promoting peptides in their pajamas on a social media post saying that they can get them to you in 24 hours. You don't know if they're making them, but most likely, if they're in their pajamas, they're getting them from either India, Korea, or China, and they're getting the powders and vialing them themselves and selling them. This is the problem. There's no difference between them and this major manufacturing facility that does CGMP certification. They're doing sterility testing, they're doing exotoxin testing, they're doing all the things that they say they should be, but you can't really know what's the difference between them and the guy on social media selling them out of their garage. There's no pharmacy laws, there's no prescriptions needed. They're oversaturating the aggressive marketing, which kills this whole concept of gray space or gray zone, or is this really safe? They just keep putting it on. They're showing people ripped. They're showing people in great shape. They're showing people losing weight. They make it seem like they're the next best thing and that it's safe to do. And that seems to be overwhelmingly getting people to want to purchase them and inject them in their bodies. But trust me, just because they're not putting out there the worry or putting out there that there are adverse effects or adverse results from these is not true. There are, I was going to list some of them, but we know they're there. There has been providers that have gotten into a pickle dealing with research use peptides. I'm not going to say that it's overwhelming, but ultimately there is a risk, and we do not know where they're coming in most cases. We're always looking for the magic pill. I mean, we have a sick society, so anybody's looking to feel better, look better, and is willing to pay the price for taking a shortcut. And the lastly is, as you can see with these industry changes, there's a shrinking of legitimate 503A and 503B peptide industry, which is making it a lot easier for these manufacturers to come in and start promoting their products. But be wary and just try to understand we can't use them. So the legal status, we just talked about it. There's no legal status for RUO peptides in the medical community at this point. If you're a biohacker, or if you're a personal trainer or a bodybuilder and you want to use these things, there's access for you. But for us, there's not. This is just, again, to show you the difference, because when you're out there, these manufacturers represent themselves almost like pharmacies. They will tell you everything that sounds like these are legit, that pharmacies are using them, that doctors are using them. It doesn't matter. Remember, this is your license and your office that you're trying to protect. And you can see there's a very distinct difference between a compounding pharmacy and a research use only manufacturer seller. And lastly is, what do we tell our patients? How do we explain this to them? It's easy. These products are not for approved from human use. They usually say it right on the vials that these people are still injecting. They're considered unregulated chemicals. We can only use peptides from legal compounding pharmacies. This protects us and them for quality and consistency. And you just use the unregulated supplement industry. I don't know if anyone remembers, in 2015, they went into DNC or GNC and they took out some 60 or 100 different supplements, and they tested them all. And most of the supplements they either didn't have any of the ingredients they promoted, or 40 or 50% less of the ingredients than they promoted. And some of them had other ingredients that weren't even on the label. And this is really, and again, this is an unregulated supplement industry. You got to think this is the same thing. Anybody can make a research use only peptide because it is not supposed to be used for humans. So your neighbor could be making these and selling them, and it doesn't matter if there's even the drug is even in it, because nobody's testing it. So just understand of the loose regulations and why we have to be concerned. So next, we'll go into some peptide stacks. And just trust me, we'll get into the good of what we can do and not just the negative part of this industry, but this is important. So peptide stacks and what we need to know. So stacks have been around forever too. I had a compounding pharmacy. I tried to make all sorts of stacks. I promise you. I still claim to have made the first person to make Calm, which was magnesium, theanine, taurine, and GABA. That was a combination I made way back in the early 2000s. And it was a good product because we got the product made in a combination where the amounts of each of the ingredients were effective. CJC ipamrelin, a growth hormone releasing peptide and a growth hormone releasing hormone combined makes sense, and you could put those actually in usable forms. TB500 and BPC. Now, when you start looking at these manufacturers, remember, they can stick anything together. It doesn't matter what they want to put in a vial, they can start making all these peptides. And remember, a lot of this is a marketing ploy. They start talking about the various peptides, but what we do know from pharmacies and pharmacists, and at least back when I was compounding with my pharmacist, is that it is very difficult once you start mixing a lot of different ingredients because they all have different pHs, they all have different constituents, uh, they all have specific ways that they work together. Some of them can precipitate, some of them need different ways or combine different ways. It just increases the difficulty to compound, which is why even the boards of pharmacies were even trying to regulate how many ingredients you could actually even compound because some of them were so unstable and a lot of them were falling out of constitution and you'd get the vial and it would be clear when it started out being red because it had methylcobalamin in it. And then furthermore, some of these peptide stacks are diluted potency. So they give you a higher price, but they take these four ingredients. You think you're getting the same amounts if you were injecting them individually, but really what's happening is you're getting a fraction amount of each of them, and you're injecting them all at the same time with a less potency than doing them separately. And then when you think about what the FDA is saying, and they're sitting there giving this list saying, hey, you can't use any of these peptides. And here we are asking to use four peptides all in one injection. And then we have to document. Remember, we have to basically, in our own notes, because we're prescribing this to a patient, why does this person need four peptides at once when we're just trying to get them on one and be safe with it? So it also makes you think a little bit just from the prescribing side of it. Is this a peptide that the ingredients make sense for my client? Do they need this? Do they need all four of them? And do they need them in these types of dosing? And so again, just remember, stacks, it sounds unbelievable. And if compounding pharmacies are going to start making them, which I know some of our pharmacy partners are making the stacks right now, they do feel that they're effective. So we have to take a look at that. But remember, the vast majority of peptide stacks, the Glow, the Clo, Wolverine, are made by research use only manufacturers. They're not as much made by compounding pharmacies because of the difficulty. You have to do all the testing, and so we're just going to have to keep our eyes and ears out for the compounding pharmacies that are making the stacks. But just realize that you have to be cautious and you have to be able to justify it as the prescriber of why you're giving that stack. So good. So now let's start getting into some of the good stuff here. So let's talk about some of the peptides that we do have, give some updates on it, talk a little bit about retatrutide, and start getting into some of the good of making some sense out of all of this. So right now, GLP-1 retatrutide update is there's mixed reports so far on its benefits. Some of our colleagues have used retatrutide and reported back good response, using it in microdoses. But there are also reports of some people having some of the side effects that they get from other GLP-1s. It's just we don't have as many users of retatrutide to really understand how good it's going to be when you compare it to other GLP-1s. But some of the people are saying that it is a good fit, and it fits. Hopefully investigational will turn into an opportunity. But just remember, retatrutide is an active investigational drug. What that means is the FDA has said before that they do not want compounding pharmacies compounding an investigational drug that is currently in clinical trials. So that is exactly where retatrutide is. So, with that being said, providers' risk may be higher than red zone peptides prescribing retatrutide. You're also not going to see as many pharmacies compounding retatrutide for the same reason. And again, we're going to talk about the pharmacies, but just understand that retatrutide, from the colleagues I've spoken to, legal, and also the research I've done, is that right now, retatrutide is one that I wouldn't prescribe to my clients. And I'll explain why. It's just because it is an active investigational drug that is in clinical trials, and the FDA is saying do not prescribe it and do not compound it. Now, as we said before, the government says a lot of things, and not everybody does exactly what they say at the same time, and they all have their reasons for it. We are just talking about what is the facts and what we're seeing, like the writing on the wall. But the good news is that there are other GLP-1s that are still solid options, which is not like other peptides. So we have to be excited that retatrutide is getting tested. There has been some mixed reports, but good reports coming back from some of my colleagues. So hopefully it is an opportunity for us going forward. But right now we have to think about it and its use with caution. So updates on GLP-1s. This is great because we continue to see a lot of great benefits with tirzepatide and semaglutide, continued improvements in autoimmune related symptoms, enhanced loss of stubborn or resistance body fat, effects of post-viral recovery or long haulers COVID. For some reason, the anti-inflammatory effects and obviously management of blood sugars and metabolic enhancement has been something to really help some of these people get over these post-viral syndromes, whether it's Epstein-Barr's, cytomegalovirus, or COVID. We've seen reduction in cardiovascular markers. A lot of people reporting back that their high blood pressure is reduced. Heart rate variability has increased. If you don't understand heart rate variability, that's one of those really good markers that we've seen a lot of people on tirzepatide have improvements in, and semaglutide, which is basically an increase in heart rate variability, which shows that they're having their parasympathetic nervous system is doing its job. They're not riding high in sympathetic tone, which is a huge thing for a lot of the females out there. So again, we've seen just really good improvements across the board when using these GLP-1s, and improved overall metabolic function. In our opinion, tirzepatide still seems to be outperforming semaglutide, but there are some people that just do better with semaglutide, and this is from a symptom standpoint. So obviously, the dual action of tirzepatide might be too much for some, and we are still finding that microdosing is still key. Um, so we still like to consider using microdosing, and we almost always are trying to get people to even if they're using it on the max dosing and they come to us, we still want to try to get them established, get their weight loss moving forward, and then start reducing or titrating their doses down so that they can be in a state where they actually are able to have a normal caloric intake, make sure that they're not losing lean muscle mass, and then have the idea of potentially coming off the drugs. But we start seeing great opportunities with these. So, um, and in the future here, we say, I think it's Grand Ave Pharmacy is compounding a tirzepatide semaglutide combination. And this is specifically for those people that are plateaued or still have stubborn fat when using semaglutide or tirzepatide alone. And we have seen reports back from physicians that have used the combinations that there was a little bit more visceral fat loss, improved metabolic markers and insulin curves. And one of the other things that they're finding with this combination is that they're getting more of the white fat conversion into brown fat or beige fat. And if you guys don't know the white and brown fat and beige fat are fats that are really full of mitochondria. They actually have a metabolic activity. And so when white fat gets converted into brown fat, that actually helps metabolic output, but also is the fat that we want. So it's a good opportunity, but again, we have to remember that these peptides are amazing, but when we at the end of the day, these are things that we expect our own biology, our own lifestyle to create. And a lot of times the benefits of these GLP-1 peptides is really just creating the environment that a good lifestyle is supposed to have. Better insulin sensitivity, better glucose management, better metabolic output, reducing inflammation. So these are things that lifestyle can create. But there are often a lot of cases of patients that come in. They seem to be doing everything right. Of course, we can't follow them everywhere, but they seem to be doing everything right and just still can't get some of this stubborn weight off and still are having, flares of some of these autoimmune diseases and things like that. And it is true. You put some of them on microdoses of these GLP-1s, and sure enough, you see some improvement in the biomarkers, improvement in their weight, improvement in their energy. And of course, that might be just the push they needed to get over the hump. And then again, remember, considering making sure all their lifestyle factors are in place, and then looking at potentially titrating them off of the drug. It's also very important, do not stop these drugs abruptly. If you're going to get someone that has gone down to a microdose, just still do not take them off abruptly. Just continue to titrate them off, lowering the dose. They're going to have a much better experience, and you do not want these people getting rebound weight gain. Very frustrating for them. So just take your time, work with your clients, but just don't stop abruptly. So prescribing considerations after understanding these rules. So where do we go from here? As I've told you, this is nothing new for any of these physicians that are providers that are listening to this, that have been doing this for a long time. We have been in the same situation trying to understand what to do. And the easiest thing is to just be smart and logical, and listen to the things that we've talked about. There's some things that you just should not do. I can tell you throughout the years, especially when I had a pharmacy, I did get visited by the Florida Board of Pharmacy. I did get visited by the DEA. I got visited by the FDA. And most of that was because they're trying to see the correlation between owning a pharmacy and being a practicing physician. Never got in any trouble, but just letting you know, I did get visited. Those visits are not nearly as likely for providers, by themselves. That was mostly because I owned a pharmacy. But if someone does visit you and you have minimized what they would be looking for, you can imagine that there's going to be less ramifications. So what that means is, don't make false claims. This is what causes the problem in most cases. It happened in COVID when people were making false claims on thymosin alpha, saying that this is going to cure COVID. All of a sudden, thymosin alpha, in the middle of a pandemic, they took thymosin alpha off of the regulatory, or onto the regulatory list, and removed it from prescribing. False claims with ephedra, false claims with HCG. So just don't make false claims. We cannot say we treat, mitigate, or cure disease, ever. We can't say that, and we definitely can't talk about any of the peptides or drugs or therapies we use are doing any of that. That's just the world we live in functional medicine. Do not use research use only peptides for patient use. What you do for your own use and how you use it, I get it. I get it. If you can't get these pharmacies and you're not prescribing them to your patients, but you absolutely want them, and you know someone in the research space, that's your own prerogative. Just don't bring them into your clinic. Don't bring them into your patients, because that is a target. If someone comes into your office and sees that you're relabeling vials, pre-filling syringes, carrying research not for human consumption, and have them in your office, you can imagine how bad that looks. And also realize we're medical providers. We don't want our patients to lose faith in our prescribing or our ethics. They don't want us to be chasing dollars and risking their life by getting research peptides that haven't gone through the same regulations that the compounding pharmacies have. It's just not worth it. You can still function without these research peptides. So just don't get swayed into doing something that you know is not good for your practice. Do not use peptides sourced from overseas, and then follow our trusted pharmacy leads. Remember, these compounding pharmacies are a lifeline. I wish I still had a compounding pharmacy, but well, actually I don't. That was a lot. But I do feel that the pharmacies are trying just as hard as we are to make available or allow us to do what we can to get the best results for our clients. And these pharmacies are you can imagine what these pharmacies are dealing with. day in, day out. They're just waiting for the FDA to come in and audit them. They're just waiting for new regulations to come out. It is a pain in the butt. But our pharmacies that we're using in this space, like I said, are our lifeline, and we need to trust them and get a partnership with the ones that are looking out for all the laws changing, but also providing us the therapies we can and helping us understand when and we can and can't prescribe. And that's all we can do right now is really follow our trusted pharmacies leads. So why are pharmacies still compounding yellow and red peptides? Well, I can tell you because again, I owned a pharmacy, and when they make these changes, even on HCG back in the time that I was owning a pharmacy, we were making HCG. They came out and said you couldn't make HCG anymore. Well, we followed kind of the same path. You know, pharmacies are expensive to operate, and the peptide business is profitable. We were trying to keep our pharmacy open. So when they said no more HCG, we stopped making it for obesity. We stopped making it for anyone that was even using it for weight loss, even though that isn't really how much we were promoting it for. We were using it mostly for HRT. So we kept compounding it for HRT only up until the time when we closed our pharmacy. And so that was the way our pharmacy said, okay, well, they said not to make it, but really the law was based off of weight loss. So we said, okay, well, you know, we're doing it the right way. We're documenting it. Our physicians are documenting it that they're using it for HRT. We're going to continue to go ahead and compound it. And we did that up until we sold our clean room just because the regulations were too high. You also have to understand these compounding pharmacies know regulations change slowly. The interpretation is so confusing. Again, if I had the timeline up of how these pharmacy changes happened, it is so confusing how back and forth they went and where they, you know, which ones are on the list, which ones are off the list, which ones could be and couldn't be. It's very confusing. And so, yes, you can play dumb and continue to like, especially if you'll hear pharmacies saying, well, we can keep making it because we still have some of the powder in we can use up all of our inventory. That's not necessarily true, but that might be a way to continue to work and continue to function and continue to allow us all to operate longer than we would have thought. Enforcement is slow, it's sporadic, and often pharmacy focused. A lot of times the pharmacies know which ones they're going after because they're making false claims. They're working with research companies. So sometimes the good pharmacies that have been in good business and have good relationships with the FDA, they have an idea of what they can and can't do and when they need to, fully adhere to the rulings. Sometimes they rely, is this the final ruling? Because we never know. We even hearing pharmacies talking about that they believe that the pharmacy rulings are going to change because of the government. Any way you look at it, we already went through what the clear laws are right now, but this is what we're talking about, what the opportunities are about. Chemical importers are continually to bring drugs to the pharmacies. The pharmacies know the demand. They know us providers want these prescriptions. We want to be able to prescribe them, and they give us the confidence to keep doing so. And then lastly, the pharmacies know, and all of us know, they understand the clinical benefits. So our job is to prevent disease, maximize vitality, make people healthy and happy, and we know that these peptides can contribute to that. It makes it very difficult for us as medical providers to turn our backs and just say that we're just going to give up on this and not fight. So some of it is also that the providers and pharmacies are all working together to try to keep operating because we know this is the best option for our patients and ourselves. You know, we're, utilizers of these products ourselves. And so, when you look at all this, you can see how we can start to find different ways to keep doing what we're doing until the final verdict comes down or we get warned. But again, it's not like if we're doing things right, it's seldom going to be that they don't come in and just say, hey, you got to do things differently. Like I said, the FDA is looking for bad prescribers, bad compounding pharmacies, people that are blatantly abusing the law. And they're also telling other doctors and they're telling everybody else that these are what the laws are. So they might help you understand compliance, but most of the time they're not going to come in and just shut you down. That has not happened. It's been very loose how the government works. And a lot of times, just so you know, it's mostly starts at the pharmacy level. And that's again why I say these pharmacies have targets. They are working very hard for us, but it's almost always starts at the pharmacies, which is another layer of security for us providers, is that if the pharmacies are making it and we're communicating with the pharmacies and they're telling us that they're in conversation communication with the FDA, there gives us a layer of protection because almost never does the FDA go straight after providers. They might put out warning letters to you to change your habits. They might make comments of your website if you're making claims or if you're posting that they're providing some of these peptides on your sites. And they also could go after very, very high volume clinics. So again, if you're doing things right, you're staying in your lane, you're not doing some of the things that are the putting a red flag out, you're going to have opportunities to continue to practice under this umbrella. So what is a safe zone? Prescribed green zone peptides. You saw that list. It's very small. Can we actively practice using just those peptides? Well, we have to. Remember, that's the name of the game is you got to figure out how we can practice using green zone peptides. But what does that mean when it comes to the red and yellow? And so if you choose to prescribe yellow or red zone peptides, this is what you have to understand. It comes with regulatory ambiguity, and you should use smart, reputable 503A and 503B pharmacies. Again, remember, use the ones that you have a good relationship with, use the ones that you've been using that have been in business for many years. Um, they are going to have some of these yellow and red peptides in their formularies. So you can ask them about them, but understand again that we're all in this working together to try to stay practicing the way we feel is efficient and reasonable. But we also have to use rationale in how we decide which ones we're going to use. Document your clinical rationale. It's always good to document. Just remember, every patient you have, this even goes back to human growth hormone. Some of you might remember they came out at one point, and I think that was around 2015 as well, where they took growth hormone and said, you cannot prescribe human growth hormone unless your patient has a true clinical deficiency. So all of a sudden, all these people we had on growth hormone, they had to go to a lab and sit and do a growth hormone stimulation test just to come out and find that their growth hormone levels were normal, which almost 99% of them or 98% of them had normal growth hormone levels. Cenogenics, one of the biggest age management clinics, which basically was built off of peptides or growth hormone and testosterone, had to start going to secretagogues. We had to stop prescribing growth hormone for a while. But then after a while, we started saying, okay, well, we're just going to document it. We do have some people with borderline growth hormone levels. And I just started documenting all of the different reasons that this person needed growth hormone with the understanding that if the FDA came in and talked to me, that I had clinical rationale to support why this patient was on it and had clinical outcomes to show how the patient benefited with these higher level of growth hormone, higher growth hormone levels, what it did to its body composition, what it did to inflammatory markers, sleep, lean muscle mass, and just in general well-being. So document, if you're using these peptides, just make sure you're documenting why you're using them, why these people couldn't tolerate statins or other drugs. They couldn't tolerate, some of the pharmaceuticals, and here they are benefiting from these peptides, and these are the reasons you're using them. There is a layer of protection for that. They might say there's not from a hard, factual regulatory standpoint, but trust me, if you are a good practicing physician, it does protect you from them coming in and saying you guys are doing everything wrong when you're actually doing most of everything right. They're just going to educate you and likely tell you to stay within regulations. And only use these peptides when necessary. If you have people that don't need them, you don't have to put everybody on a peptide. I mean, it's not all about the money. It's about doing safe practicing of medicine and doing what's best for the client. And a lot of people don't need these peptides. I mean, if there are people that have a great lifestyle, you can use some of the other modalities to help these people and not have to use the peptides on everybody. And remember, we do have peptides that we can still use. So let's get into the last part here, which is functional medicine foundation. So again, functional medicine isn't going away. Functional medicine is based off of lifestyle. I actually call it lifestyle medicine. Sleep, diet, exercise, micronutrient correction, hormones. Now that we have hormones that have come into the spotlight, they're taking off black box warnings. They are opening the doors for HRT and TRT. So, we have options, and this is the backbone of functional medicine. Correcting lifestyle, nutrient injections, IVs, HRT, TRT, biologics, we can still use them. We just have to be more educated and use education for our clients for using any of these tissue-derived therapies. Psychedelics is making a rebound. I have been using psychedelics for uh, going on 13, 14 years now in my practice. I've studied them for a long time. This is another opportunity going forward. Aesthetics are always stable. And peptides, we still have peptides. We still have this functional medicine foundation that we can utilize, and we just have to be smart of how we navigate through the ones that they're removing, pay attention, and learn from our pharmacy partners on which ones we can continue to use, but then just use your head when you're getting kind of pulled away from what your foundation of functional medicine is, where you start thinking, going, oh man, these other clinics are using research use peptides. I just want to try them. You got to make some sense of this, guys. I mean, again, I have people that I know in the research world. It just doesn't mix with when you have a medical license. So if you can stay with this foundation of functional medicine, you can be profitable. You can deliver great medicine. There is a massive amounts of customers out there. There are going to be more people moving into wanting functional medicine than ever before, especially after the HRT TRT change. Just remember, in the late 90s, early 2000s, there was about 30 to 40% of people, women and men, utilizing hormones. After that 2002 Women's Health Initiative, it went down to less than 2%. So now we have this resurgence, and there's a social media push. Now we have internet, we have the social media to push this. You're going to see tons of people coming in now saying, hey, what about hormones? I'm already seeing it. Women that have never done hormone therapy are coming in and saying, hey, I've just been hearing so much about it. I figured I might as well get a baseline. Well, guess what? A baseline is usually going to uncover some sort of hormone opportunity. So again, we have opportunities with hormones. We can use peptides and some of the other therapies as adjuvants to just good solid lifestyle changes. But this slide here is just to say, don't give up. Don't worry too much about where we're at. Just use your head, be smart, and just pay attention to these pharmacies and what they have. And I think the last slide, this is where Shelly's going to step in and talk a little bit about MyPracticeConnect. This is an application that we made many years ago, specifically for us. We are currently practicing physicians, and so we use this application to help us with managing our compounded pharmaceuticals, managing the monetary movement and documentation, and making sure that our pharmacy partners are also looking out just like we are to make sure that they're following regulations, and so that we can have some layer of using MPC to help with us, basically navigate a very difficult path with peptides and other hormones. We're a DEA certified, so we can send controlled substances, but it really becomes useful when we help with documentation, and also even the documentation that you can use inside your consultation notes to justify when we do use some of these yellow and red peptides. So hopefully that makes sense. In an ending statement, I just make sure that, again, that the regulatory landscape that I described is the facts. That is the truth. But hopefully you can see that historically that we do find ways to work within these regulations, and the FDA is not trying to just absolutely destroy everybody's functional medicine practice. They just want things done safely, and sometimes they strong arm everybody, and then we have to kind of look and move through it a little bit slower at the beginning. But there's still great opportunities for us going forward.
Okay. So we do have a few questions in here that we probably won't get to on the webinar unless we can do it, and I can speak really fast. But we will get those out in the email when we send the follow-up. So don't worry, your questions will be answered. But I do want to just take a hot second to just let you know that everything that Dr. Agin has shared with you, he has invested in the MPC platform to help you stay compliant, to provide you with an online platform where you can order controlled substances seamlessly inside the platform. We have our customer service team that can help everybody kind of just get through the process. You can call us and ask us questions. We have a medical support team. We're trying to stay ahead of the regulations so that we can provide our providers what they need to educate their patients, especially how fast everything is changing with the research use only. We get a lot of questions coming in about, well, why can't I order it from here? I see it so cheap from here. Why is it so expensive with you? We help give you resources and education so that you can educate your clients and make sure that their therapies are not going to be interrupted by basically some bad drugs that they wanted to get for a lower price. We do try to work with you also to source anything that you're looking for. We have a lot of people call us up and say, I want to find this. We can't find that. We have 15 vetted 503A and B pharmacies on our platform. We are partnering with them every day, and we're able to get them to bring more products on if we have that volume. So as a co-op experience, we'd love to see you join our community, because you're going to be able to experience a lot of those things that Dr. Agin has talked about in terms of the peptides and understanding how to dose them and all that good stuff. So on the next slide, I do want to tell you, like this, we just had this quote. I use MPC every day. I don't know what I'd do without it. And I just thought that was so perfect for now. We have a lot of people on this call and who have signed up that have never even been on our platform or seen it. So please, if you're interested in a demo, let us show you. Give us like 15, 20 minutes. We'll give you a demo of it and show you how powerful it is. What makes us different from our competition? One of the things we're seeing right now is a lot of different portals are popping up. It's really hard to know where you're going to get the value and your money's worth. Our platform is very affordable. And we even have an option for you to pay over time if that's something you need to do just to get it into your system and get going. But what makes us different is that we listen to our providers, and we're constantly creating new features that people are wanting. So you're really just a stone's throw away from Dr. Agin, who's created these things, who's educated, and who's been basically dedicating his life to peptides and to providing different options. And I'll tell you about one in a second that's coming out in 2026. Our platform, like Dr. Agin said, is a DEA certified platform. We actually pay for all of our ID.me renewals for our doctors to make sure that they have an updated ID.me account, and the pharmacies love having that next extra layer of protection. So we offer medical support. We have a great medical team. Kathy's not on here right now, but she's been with Brent for 23 years. They're kind of like yin and yang in all of this. They work well together. You're going to get support from all of us. Our customer service team loves to be on the phone and helping you out. So we really are like live humans that are dedicated to helping our fellow citizens in America have the best life possible by owning their health. We also have lots of training opportunities. We'll see that on the next slide. And well, we'll move right on to our consultation module. This is what's coming. We've been working on it for well over a year, probably closer to 2 years, just really honing it down. But we're going to be able to offer you a consultation module. You will get best pricing by having a platform account now. So it is something to consider, but this will actually help guide you through a weight management consultation, HRT, sexual health, cognitive health, mindful medicine. Basically, we're going to be giving you a way to send a link to your client, your patient, having them send it back in with all their answers. It will help identify the contraindications. It will give you a spot to add provider notes. It's kind of very similar. I think a lot of functional medicine only can use this as their EMR, but we also have the ability to link this to our CRM, Go High Level. So you could actually have your own CRM with this new release in 2026. So you can see the other things on here, but this is just another thing that we have done for our own team, but also for all of you providers. If you want to sign up for training, or if you want to sign up for a demo, just say demo in the chat and Casey will get you set up for a demo. And we actually have really great pricing for our webinar attendees. If you look here, Dr. Agin has a training site. It's actually under construction. It still works, but it's a little bit it's kind of it might be a little bit hard for you to navigate. We've actually had success with it, but we really want to have something even better. So we're working on that. But our IV therapy training, peptide weight loss, those are all $14.95. With that, you get $1,000 training I'm sorry, MPC platform for free. So our platform, the basic standard one is $9.95. So if you think about that, for that therapy training, you're going to get not only the platform, but you're going to get 6 months of free medical support from our team. So that is, if you have a tough case, you have clients that are asking a lot of questions, you're new to the game, you're switching over from traditional medicine. Our team has over, I mean, 60 years of experience just in our team. Collectively, we can help you get to the next level with your clients and with your business. So we also have sexual health and rejuvenation. That's at $7.95, and then you can do a customized. We do customized trainings for a lot of people that they want to do something specific. They want to cover 2 or 3 of them, and some people want to come in and train with us. Some people want us to come and train with their team elsewhere. So right now, our social media package is 40. Actually, there's 47 ready to use peptide posts. They fit Instagram and Facebook. You're kind of looking at what one looks like. It will promote your practice because you can add your own branding on there. And today only for our clients here, anybody that comes to this webinar live, it's $95. For webinar, I'm sorry, for current MPC clients and you're on here, it's $95. If you're a webinar attendee, it's $195, but we will be selling that for $395 on our trainable or our teachable training site. So this is a great time to get it. If you want that, please go ahead and put peptide social media or social media in the chat. We will get that out to you. We'll send you an invoice. We'll send it over to you. It's in Canva. We can help you with that as well if you need any training. So I know I'm a couple minutes over, but it's really important for you guys to know that this team really wants to work with you. And we do have these every month now. You'll get a notification on the next one. And I don't even remember what it was. The next one's coming up in December, but we look forward to seeing you and we'll answer those questions and send them out. So we'll leave this on a couple minutes so that you can choose demo, you can say training, or you can say social media, and we'll hook up with you after this. But let's go ahead and do the spin real quick, Casey. Okay, so we're just a spin to win. Somebody's going to get the 47 peptide social media posts. These are everybody who has attended today. Monica McOver.
Monica still here?
I don't know, but due to time, we will go ahead and get that to Monica and let us know if we can help. Thank you.